This is our website, which has really been enhanced with the help of the advocacy group, and it's www.accreditedbreastcenters.org. Just want to bring you up to date on something that just recently was completed with our accredited centers. We sent out a survey to them, and it illustrates the fact that just preparation for accreditation resulted in enhanced organization and coordination within the center. That was affirmative response in over 80% of the centers that have been accredited. What does that tell us? That tells us that breast centers in the United States, and nobody knows how many there are, have bits and pieces in their program. They're disparate pieces, and doing this and getting ready for survey organizes it, coordinates it, gets people talking to one another again. And it takes 3 to 6 months in 45–50% of patients, and up to 9 months for the others. So this is something that doesn't happen instantly. You need to get organized at the local level and talk to one another and get the administration behind it. And so we think by virtue of this that we're actually raising the bar before we even arrive there to survey the program. So we do think accreditation does indeed make a difference. As I mentioned earlier, we are interested in a more global approach to this as I sit at this conference and hear about some of these major gaps that this organization is addressing. Perhaps there can be some way that we can collaborate to outreach with the NAPBC to improve evaluation and management. I can tell you that whether it's a poor country or middle resource or high resource, particularly the low and middle, you might say, we can't possibly do this. Well, you can do it. How do you do it? It takes a will to do it. It takes a recognition that organization in a multidisciplinary fashion does pay off. It requires significant volunteerism. You put these things together, those don't cost much. You don't have to have a PET scanner necessarily to be a good breast center. Put it together, put the leadership together, and you can do it. So thank you very much.
Thank you very much, David, for this great insight into the QA/QC of the infrastructure for running a breast cancer management program.